With the coronavirus pandemic rattling economies around Europe, the question of how the bloc will respond hangs in the air. So-called coronabonds, a form of shared debt among EU nations, has been mooted as a solution. But that's exposed a rift between countries like Italy and Spain calling for the bonds and others like Germany and the Netherlands who are against them. It is one of the elements testing European solidarity in a time of crisis.
Hospitals in Italy have faced a massive challenge to treat all their patients critically ill with COVID-19 disease. Spain's Prime Minister has called the pandemic Europe's biggest crisis since the Second World War. But help has come for some in the form of the German Air Force. Specially equipped Luftwaffe planes have flown COVID patients from Italy and France to hospitals in Germany. In all, more than 200 sick people have been transferred from European countries. Even in the time of corona, Germany sees itself as a good European. We want to and we will show solidarity. We've proved that in the past, but this is a crisis that affects us all, both in terms of health and economically and financially. That's why we must take care in these times that the EU stays together. But when it comes to financial help, Germany is less ready to offer everything that is asked for. The EU has agreed big support packages worth more than €3 trillion to counter the economic effects of the crisis, such as the huge hit to European tourism. But Italy, France and Spain would like Brussels to go further and issue coronabonds, a new form of shared debt. Many German politicians worry that would put new burdens on the German taxpayer. This crisis is no reason to bring in through the back door financial instruments that involve public debt, which were wrong in the past and will be wrong in the future. Corona bonds would lead to more debt and also mean that all of Europe ultimately loses. But others say if European unity means anything, it should be about flexing Germany's economic muscles during this crisis.
Wir brauchen temporäre Corona-bonds.
We need temporary corona bonds to help the worst affected countries. We need them for selfish reasons too. The German car industry is reliant on production happening in northern Italy. So it's not just about solidarity. It's in our own interest to do the smart thing. The pandemic has brought neighbours together, but it's also put strains on relationships for individuals and nations. For now, while Europe works out how to organise aid for the long term, direct help for the sick will continue.
But what about the financial sickness that's gripping Europe? DW political correspondent Nina Haser joins me for more. Nina, good morning. Help us understand why corona bonds are such a sensitive topic.
Well, you have to understand that it's not the first crisis in which common bonds, so a common financial instrument to get money on the markets, is being discussed by the members of the Eurozone. This was also the case 10 years ago in the financial crisis. And already then it was a contentious issue. It is a financial instrument that basically combines securities from different European countries. And you have to remember they do share a currency, but they don't have a joint fiscal policy. So the fear by the fiscally conservative countries like Germany and the Netherlands is that their own taxpayers would basically pay for other countries' liabilities.
Now, Italy appears to have softened its position on these corona bonds. How is that going to be interpreted?
Italy's President Conte was very adamant up until yesterday. He said that he would have to make sure that he did fight the battle until the very end for corona bonds and that there could be no compromise. And now he's softened his position ahead of an upcoming EU summit on Thursday, where EU leaders will discuss the question of how to get out of this crisis together and how to help the countries that have been most affected. You have to remember that the EU Commission is estimating that a tenth of the bloc's economic situation can actually disappear in this crisis. So it can suffer really badly, really bad economic implications. And so Italy's Conte has now said, the president, that he wants to find a solution quickly and that there's no time to fight for something where you'd have to change the treaties. And so he's ready to support proposals by countries like France and Spain that have put proposals on the table.
So what should we be expecting from EU leaders when they meet on Thursday?
EU leaders will talk in a video conference, and the 27 leaders of the European Union's countries, they will sign off a 540 billion package that is supposed to be an emergency rescue fund in this crisis. But of course, the big question is how do you finance what they've called an economic recovery fund that is more destined for long-term economic relief? And of course, the topic of coronabonds is still on the table and it won't go away anytime soon. So I would be surprised if this was a short summit.
Ina Haza, thank you very much for that. And here's a look at some other stories making headlines around the world. US President Donald Trump says his new immigration ban will last for 60 days and affect those seeking green cards for permanent residence. Earlier, he had said he would sign an executive order to suspend all immigration in response to the coronavirus outbreak and to protect jobs. The UK Parliament has gone back to work after some 3 weeks under lockdown restrictions. Very few lawmakers were physically present in the chamber on Tuesday, and they sat far apart. Instead, many others joined for the first time ever via video conferencing. Britain is also among the countries hardest hit by the coronavirus pandemic, with the death toll surging above 17,000. The government has faced criticism for being too slow to prepare for the outbreak and imposing a lockdown. But one part of its strategy is beginning to bear fruit, with the first human trials of an anti-coronavirus vaccine due to start in the UK today.
A country scrambling to deal with a coronavirus pandemic. This convention center in northern England has been turned into a makeshift hospital. The transformation took less than 3 weeks. The UK is racing to increase hospital capacity to cope with an ever-increasing caseload. The British government has been heavily criticized for failing to prepare for the outbreak. It's now hoping to beat the virus by investing heavily in vaccines being developed at universities in Oxford and London. Trials on humans are set to begin on Thursday.
In the long run, the best way to defeat coronavirus is through a vaccine. After all, this is a new disease. This is uncertain science, but I'm certain that we will throw everything we've got at developing a vaccine.
The potential vaccine is based on research into previous viruses.
When this new virus emerged, there was already work going on here in Oxford on the MERS coronavirus, and a vaccine was being trialled in humans. And so what happened was that the genetic code from the new coronavirus was discovered in January of this year, and it was possible to go back to that genetic code and make these new vaccines very rapidly.
But even if the human trials prove successful, they offer no quick fix. Similar tests are already being conducted in the United States. Researchers there say it's likely to take more than a year before a vaccine is widely available.
Now to some other coronavirus news from around the world. Researchers in Switzerland say it's possible that mass vaccination could begin there as early as October if trials prove successful and approval procedures are fast-tracked. Singapore has reported more than 1,000 new infections in a single day, bringing its total to more than 10,000 cases. The United Nations is warning that the coronavirus pandemic could trigger famine in vulnerable countries. The UN says the number of people facing acute hunger could double to more than 250 million this year alone. And the US state of Missouri has filed a lawsuit against China, saying Beijing tried to cover up the danger posed by the virus. Epidemiologists are placing great hope in so-called tracking apps for smartphones to help get the coronavirus pandemic under control. Singapore and South Korea already have tracking apps, but but data protection regulations there are not as strict as they are in Europe. A German company is now working with 130 specialists from Europe on a Europe-wide app in compliance with European data protection standards. The programs anonymously record the user's location data via Bluetooth to detect and interrupt chains of infection. If any user is corona positive, all users receive an alert. For more, I'm joined by Chris Bose, co-initiator of this European initiative called Pan-European Privacy Preserving Proximity Tracing, or PEPPT. Mr. Bose, welcome. It's quite a mouthful there. But this initiative that you are the co-founder of is advocating an EU-wide app, and you're also advising the German government on it. How will this app work?
I'm totally amazed that you could speak the name. This is what happens when scientists create naming. You're doing better than us most of the time. Let me first say something very important. We're not creating an app because an app itself has to fit in with the local health system of a country, because every health system is a little bit different. The legislation around is a little bit different. The services are organized differently. So the apps will have to integrate with that to offer the best type of integration with all the measures and restrictions that a country takes. What we're offering at PEPPT is a layer under the apps that does three things. Basically, it gives good measurement so that you know that how far are you away from somebody. That is exact. No point in measuring like 2 meters distance when your accuracy is only 10 meters. The second is privacy preservation with different models, right? The idea is that there are different privacy models, but there is a common denominator, which for Europe at least is GDPR, meaning that simply the only thing that could reveal a person's identity is the person itself. And the third one is interoperability, because it's important if we loosen restrictions in one country, we still have closed borders. So the ability to trace infections has to go beyond other countries. And for this, no data is used that actually would allow anyone to track back a person. Location data is not used. Wi-Fi data is not used. Your SIM card IDs or MAC IDs and all these things are not used. It's always stays on the private level.
Right. I love talking about technical modalities. I really do get them. But then similar apps are being used in Asia. So what you are saying, how is that different to what's happening in Asia?
Well, in Asia, where societies need or want less data protection, basically what was implemented was external surveillance. So face recognition that was used, or publishing the location of sick people so other people around that could be warned. I don't think that this type of surveillance would be acceptable in any European democracy. Right. So our question was, it was obvious that this could be a key building block in quelling an outbreak. And the example is Wuhan in China, or China in general. But then now, in order to leave your house, you have to put your app down, and the door will only open if the app says you're not in danger of spreading an infection. So that, I think, is completely out of the order for Europe. So our question was, can we do something that would allow people to still have privacy preservation? I mean, the whole point is, until there is a vaccine, we will have to manage this pandemic, and managing it while we still have a life and not all stay at home. Managing it means that we have to go and find an infection and get the people that possibly could have been infected very quickly, so the infection can't spread. And that's the whole idea of having an app instead of doing interviews. Who did you meet last week with someone who's been tested positive?
Apps the way appears to be the way. Chris Bose, thank you very much for joining us.
Thank you.
The German container ship Essen Express started its journey from Europe to Asia back in January, before the coronavirus had spread around the world. The crew started becoming aware of the seriousness of the outbreak as they traveled closer to its epicenter. Now, several months on, they still don't know when they will be able to set foot on land.
366 meters long, with a load capacity of 13,000 containers, the Essen Express runs between Europe and Asia regularly. Captain Tobias Kammann and his crew took off in January from the Italian city of Genoa. Back then, the coronavirus was not yet a pandemic. Few people had even heard of it.
I was the last of the crew members on land. That was also the day I had my last haircut.
What the crew experienced in the following weeks and months was like a chronicle of the pandemic.
It slowly started while we were in Egypt. Some port pilots and officials were already wearing face masks and gloves. The further we traveled toward Asia, the more we noticed how serious the situation really was.
They passed through Suez Canal in early February. Their days on board the ship changed little. It wasn't possible to impose social distancing restrictions. The company asked them to take body temperatures daily and sent the crew protective gear. The captain stashed away some extra food.
We had enough reserves for 2 weeks more than usual. Just in case we got stuck at some port or authorities banned us from leaving because someone got infected.
To minimize the risk of infection, contacts with staff at the ports were reduced to the essential. And just as the pandemic reached its peak, the Essen Express arrived in China. All port pilots were working with full protective gear. The crew was not allowed to go ashore and a change of crew wasn't possible.
That's not possible because many ports won't allow it. On the other hand, there aren't any flights available to send back personnel or to get them on board.
The pandemic spread quickly across Europe and the Essen Express crew was trapped on board. Captain Kalman ordered extra SIM cards so the crew members could stay in touch with their families. Their next stops were in Barcelona, Tangiers and Genoa, where the crew had to stay on board. Only the cargo of medicine and medical equipment was unloaded.
It does make you feel a little proud because you're actually helping people. Not just by bringing groceries, but maybe even some face masks.
Now they're on the way back to Asia. Perhaps the crew will finally be able to disembark in Singapore or Hong Kong.
The International Olympic Committee has been forced to backtrack over who will bear the costs of the postponed Tokyo Games. That's after Japan complained a section on the IOC website had wrongly quoted its prime minister as saying his country would pay the extra costs. It comes as some Japanese scientists have cast doubt on the Olympics taking place at all next year due to the pandemic.
With the Olympic fireworks on hold until next year, Games organisers face a monumental challenge, not to mention a massive bill. But the question of who picks up that tab is causing tension between Japan and the International Olympic Committee. A section on the IOC website previously said Japan will continue to cover the costs as it would have done under the terms of the existing agreement for 2020. Though in line with contractual obligations, the sentiment angered Japan's government, and that section has since been deleted.
There's no such agreement related to additional costs stemming from the postponement.
Estimates suggest postponement will cost in the range of $2 to $6 billion. Tough to swallow for Japanese taxpayers, especially at a time of economic struggle. The IOC, aware of the cost burden, has already hinted that next year's Games may need to be scaled back.
We'll be exploring all opportunities to optimise and streamline the scope and service levels at the Games and reduce the costs that have been caused by the postponement.
But that's if they take place at all. The Olympics attract hundreds of thousands of people from all over the world. One Japanese virologist thinks that remains a recipe for disaster.
In this regard, I'm very pessimistic about holding Olympic Games in next summer, unless you hold Olympic Games in a totally different structures, such as no audience or very limited participations or such and such.
Organisers say they don't have a plan B, maybe because plan A is proving difficult enough to navigate.